Hello, lovely people. This is the Ghanaian Doctor, and today I'm going to discuss adenomyosis. Usually, the womb or the uterus is made up of three different layers: an outer layer called the serosa, an inner layer called the endometrium, and a middle layer called the myometrium. Now, the middle layer is the muscle layer, and this is where adenomyosis occurs. During adenomyosis, what happens is the endometrial layer or the inner layer moves from the inner layer into the middle layer. And when it's moving, it goes with its glands and it still responds to the normal hormonal stimulation that happens during menses. This means that every time during menses, the pain that is felt in the endometrium will be felt in the myometrium or the muscle layer as well. What's what this leads to is very painful sex, heavy bleeding, intermenstrual bleeding, abnormal menstrual bleeding, and very painful menstrual episodes. There are other theories that contribute to what brings about adenomyosis. Other theories say that increased levels of estrogen is what accounts for some case of adenomyosis. And other theories also communicate that a reduction in immunity can also bring about adenomyosis. So, if you have adenomyosis, baby, the next topic. Hold on. Hi. Complications. So, what are some of the complications of adenomyosis? Apart from the severe pain which comes with adenomyosis, it's also related to miscarriages and difficulty getting pregnant. If you have adenomyosis, there are two main modes of management. When you go to a hospital, your doctor will first do an ultrasound scan or an MRI scan. Unfortunately, adenomyosis is very underdiagnosed, and most of the time, ultrasound scans and even MRI scans are not able to pick up the medical condition. The only way that most of the time adenomyosis is picked up is when the uterus is removed, and afterwards, a sample of it is sent to the lab and it confirms adenomyosis. So, after your doctor is suspecting that you have adenomyosis, there are two main ways that he can manage you. The first way is to give you medications to try and reduce the pain. These medications could be non-steroidal anti-inflammatory drugs, NSAIDs. Examples include ibuprofen, naproxen, or even diclofenac. The problem is these medications, even though they work directly to reduce the factors, which is prostaglandins, which cause the pain in adenomyosis, they are not very effective in reducing pain in adenomyosis. Most people rather respond to hormonal medications like danazol or combined oral contraceptive pills. What these hormonal medications do is that they reduce the sensitivity of the adenomyosis tissue to estrogen, or they reduce the level of estrogen in the body, or they induce a form of menopause where there is no ovulation. And if there's no ovulation, then there is no stimulation for the adenomyosis tissue, and this controls the pain in most people. In some people, however, this is definitely not enough to control the pain and they need something more. In such situations, the only option available is to do a surgery where the womb is literally removed from the body. When the womb is removed through a process called hysterectomy, unfortunately, the person is not able to get pregnant by herself. The only way the person can get pregnant is through surrogacy, where another individual is used to where another individual is used to carry the pregnancy for the person. So the person's egg and the person's partner's sperm is put together in the lab in a process we call in vitro fertilization or IVF. And then when an embryo or a baby begins to form, this baby is implanted in a different person's body. And then when the baby is delivered, the baby is given back to the person with no womb. Adenomyosis is a very disturbing medical condition and it causes severe pain in a lot of women. If you know anyone who has very severe pain at menses, who bleeds a lot during menses, has intermenstrual bleeding, it could be adenomyosis. Other medical conditions like fibroids and endometriosis can present similar to it, but adenomyosis is usually missed because people do not suspect it. Visit your hospital, visit your medical doctor. Let's investigate and find out if we can get some medical treatment for you. Thank you for listening. Take care. See you on the next one. Thank you.